Ladies and gentlemen, please welcome to the stage NFID Vice President Dr. Walter Ornstein.
Good evening. It is my pleasure to tell you about the 2013 Maxwell Finland Award for Scientific Achievement. The Maxwell Finland Award is presented to a scientist who has made outstanding contributions to the understanding of infectious diseases or public health. The selection criteria for the award are: 1, excellence in clinical or research activities, participation in the training of future leaders in the field, and positive impact on the health of humankind. The award is named in memory of Dr. Maxwell Finland, distinguished scholar, scientist, and teacher. A former member of the NFID Board of Directors, Dr. Finland was a driving force in shaping infectious disease training programs in the United States and in defining the discipline of infectious diseases as we know it today. And now, to tell you about tonight's distinguished honoree, I am pleased to introduce Dr. Stanley Plotkin. Dr. Plotkin is Emeritus Professor at the University of Pennsylvania and was the recipient of the 2009 Maxwell Finland Award. Stan?
It is my pleasure to introduce Dr. Paul Offit, who is a hero. I will explain why in a moment. Paul was born in Baltimore, Maryland, and I'm sure was delirious recently when the Ravens won the Super Bowl. Be that as it may, he left Baltimore in 1969 to attend college in Boston at Tufts University, but then returned to Baltimore to attend medical school at the University of Maryland. His internship and residency were at the Children's Hospital in Pittsburgh. Paul came to Children's Hospital of Philadelphia in 1982 to be interviewed for a fellowship position in the Infectious Diseases Division, of which I was then the chief. I remember interviewing a bearded, hirsute young man whose appearance resembled that of a Russian anarchist, but whose personality was clearly one of intense ambition and a quizzical and skeptical attitude towards authority. He was accepted into fellowship and promptly plunged into clinical studies and also entered the laboratory to study rotaviruses. It became clear that he was talented in both areas. Working with the late Fred Clark and myself, Paul involved himself in rotavirus vaccine development. During the 1980s and the 1990s, there was intense competition to develop a vaccine. And in 1998, a vaccine was developed by NIH and was licensed, only to be recalled in 1999 owing to safety issues. However, efforts continued in Philadelphia and elsewhere, and Paul was greatly responsible for convincing Merck, despite the earlier failure, to pursue development and licensure of a safer vaccine that had been created at CHOP. The pentavalent vaccine was licensed in 2006, and the result was the prompt decline of rotavirus infantile gastroenteritis and dehydration in the United States. The vaccine is now being applied elsewhere, including developing countries where thousands of children die each year from rotavirus infection. Meanwhile, Paul climbed the academic ladder, spending time doing research at the Wistar Institute, also on the Penn campus, and at Stanford in California, before returning to CHOP. In 1992, he became my successor as Chief of Infectious Diseases, and in 2000 was appointed Maurice Hilleman Professor of Pediatrics at Penn. As chief, he expanded the division to its present state as a preeminent division of infectious diseases. It incorporates 9 full-time faculty who work on viruses, bacteria, fungi, epidemiology, and other aspects of infectious diseases, as well as a 3-year fellowship program that is now training 9 fellows. Along the way, in 1998, Paul started to write books for parents about vaccines and other subjects, and it became clear that he had a talent for expository prose. He also founded a vaccine education center at CHOP, as well as a Center for Vaccine Ethics. Paul became immersed in issues of vaccine safety beginning in about 2000, and in 2005 published a book on the Qatar incident, the Qatar polio vaccine incident. In 2007, he wrote a biography of Maurice Hilleman, and in 2008, a book on the false connection between autism and measles vaccination that had been foisted on the public by a now discredited British physician. As he gave more talks and wrote more articles, he rapidly engendered the hostility of anti-vaccinationists to the extent of undergoing calumny and threats against his life. Nevertheless, he persevered, undaunted, and in 2011 published a book criticizing the anti-vaccination movement. This year, he will publish a book on the folly of alternative medicine, and he tells me that there is one in the works on religious objections to vaccination. Pretty soon, there will not be a nincompoop in the entire United States who doesn't hate Paul. However, those of us who believe in science, reason, and prevention of disease realize that Paul has become a champion for the health of children. He is now a co-editor of the vaccines textbook, and all of us are grateful for what he has done through his books for the lay public, his lectures, and his work to make life safer for children throughout the world. Certainly, I am proud to have been his teacher. I have not cited the many honors Paul has already received, as the list is long, and the 2013 Maxwell Finland Award is a capstone to that list. But the greatest honor anyone can receive is the respect and admiration of his peers, which Paul has amply earned. He has excelled in science, in communication, and in fighting the good fight. And so, ladies and gentlemen, I present to you a real American hero, Dr. Paul Offit.
Dr. Paul Offit, the Maxwell Finland Award for Scientific Achievement is being presented to you for your outstanding work in vaccine development and advocacy. As a pediatrician, researcher, academician, administrator, and author, your work has helped to save hundreds of thousands of lives. The National Foundation for Infectious Diseases is proud to honor you with the 2013 Maxwell Finland Award for Scientific Achievement.
Thank you, and thank you, Stan. But I'm going to get you back at the end of this talk. A few years ago, I was asked to testify about vaccines in front of the Connecticut State Legislature. When I finished, a woman came up to me at the podium and started screaming at me, angry that I had dared to say that vaccines were safe. She believed her son had been harmed by vaccines and was angry that I had defended them. It shook me up, it always does. Later, one of the legislators, while giving me a ride to the train station, told me something I haven't forgotten. "You know you've gotten to the center of things," she said, "when you meet the very best people and the very worst people." My good fortune is that I've certainly gotten to meet the very best people who have taught me to stand up for science, to be brave, and to do what's right, even if doing the right thing isn't always the easy thing. Many of these people are in this room tonight. For example, in the early 1980s, while a resident at UCSF, Julie Gerberding stood in front of the cameras holding a baby with AIDS. This was at a time when people were scared to buy fruit in a grocery store because they were scared of catching the disease. Gerberding showed that people with AIDS should be embraced, not shunned. In 1982, when the documentary DPT Vaccine Roulette gave birth to the false belief that the whole cell pertussis vaccine caused permanent brain damage, people like Bill Schaffner and Marie Griffin stood up for the science that failed to support the contention, even if it meant confronting hostile anti-vaccine groups like Dissatisfied Parents Together, later to become the National Vaccine Information Center. In the 1990s, when Lyme advocates believed that the disease accounted for a broad range of chronic symptoms, and charlatans offered a variety of expensive and potentially dangerous cures, people like Gary Wormser, Hank Fader, Gene Shapiro, and others stood up for the science, unwilling to let people be taken in by the scam, even though it meant facing an unfriendly media and becoming the bad guys in popular documentaries like Under Our Skin. And when Richard Blumenthal, then Attorney General of Connecticut, forced the Infectious Diseases Society of America to reconsider its statement warning of the dangers of bogus Lyme cures, Carol Baker headed the committee that reinforced the IDSA's original conclusions, even though she was under tremendous pressure not to do it, even though it meant threatening calls and emails from Lyme advocacy groups. In 1998, when Andrew Wakefield claimed that MMR vaccine caused autism, Dave Weldon, a Republican congressman from Florida and member of the House Appropriations Committee, pressured Walter Ornstein, then head of the National Immunization Program, to offer MMR as separate vaccines. Despite the Appropriation Committee's influence over the CDC, Ornstein never backed down. When Wakefield's contention that MMR vaccine morphed into the notion, that MMR vaccine caused autism morphed into the notion that vaccines could be causing a variety of chronic diseases, many people stood up, like Amy Pisani, executive director of Betty Bumpers and Rosalind Carter's foundation, Every Child by Two, and Deborah Wexler, whose organization, the Immunization Action Coalition, was founded originally to provide hepatitis B vaccine to immigrant populations in the Minneapolis area that couldn't afford it, and Karen Ernst and Ashley Shelby, who founded the organization Voices for Vaccines because they were sickened by the fact that the only parents sought out by the media and legislators to comment on vaccines were those who opposed them. They knew that most parents supported vaccines, and they wanted their voices to be heard. And Allison Singer, who, when Autism Speaks failed to support the science that exonerated vaccines, broke away from that group and formed her own advocacy group, the Autism Science Foundation, even though she had to face constant criticism from others who, like her, were parents of children with autism. And when children in New York City developed fatal herpes simplex virus infections as a consequence of an ancient religious custom associated with circumcision, Bill Schaffner was quoted in the New York Times as saying, "The primacy of all religions is the safety of human beings, not their rituals. Taking on any aspect of religion in this country is never an easy thing to do." But for me, the person who has served as the greatest inspiration for standing up for science, as well as how to think and act and write like a scientist, is Stanley Plotkin. The first time I saw Stanley was in 1980 when I walked into his office as a first-year fellow, bearded, as he correctly states. He was reading an issue of Morbidity and Mortality Weekly Report that described the incidence of congenital rubella syndrome during the previous year, a year in which his vaccine, the RA27-3 strain, had been introduced. It was an amazing sight. Here I had been taking care of one patient at a time as a pediatric resident, and he was taking care of the world's population of children. Dr. Plotkin, more than any other person, taught me the power of vaccines. And when Herb Denenberg, a local consumer reporter in Philadelphia, took up the cause that the whole cell pertussis vaccine was doing far more harm than good, I watched Dr. Plotkin angrily pick up the phone and, using a withering logic that I could only pray I would never have to face, tore Mr. Denenberg to shreds. So while I have certainly met my share of the very worst people, I have also met more than my share of the very best people. In that, I've been enormously fortunate, and I'll never forget it. Thank you.